Good morning, good evening, good night, older persons, family caregivers, entrepreneurs. Hello and welcome back to Lana's Little Things, where we talk about living agelessly, bridging generational gaps, entrepreneurship, life itself, not to mention family caregiving. Of course, that goes without saying. But as we are in the Alzheimer's and Mental Health Month, I thought I would present today's topic, which I know you've been waiting for a long time. And you're like, when's she going to get to this? Because this is reality. And all this ageless talk, and let's just live a real life. Okay, shall we? All right. So, my all week long, I'm encountering persons who, but age and pain go together. I have to have some sort of pain when I get older. Got to prepare for the neck pain, for the shoulder pain, for the back pain, Got to remember that the knees might give out. Okay. I give up. I give in and you win. Okay. So we will talk today about pain. Pain as you get older. And whether you are young old, middle old, older, oldest old. From There are times when you just a joint, a hip, a shoulder, something is going to hurt. But remember, and I'm gonna say it again, aging is not a disease. It is a process. We had spoken sometimes on changes in the body that happen with age. Well, joints do have less cartilage, they have less bounciness, skin does get thinner, movement tends to, yes, become less, even thinking processes are slower, although connections in the brain are greater as you get older. Hence, age brings wisdom. But does even if you are aging and joints are changing, and yes, you may have. I always say if you've been sedentary, you're gonna pay for it. The joints will, they haven't moved. Can't expect them to move after 50, 60, 70 years. Also, if you've lived a very active lifestyle, you kind of pay for that too, don't you? Because the wear and tear, if you play tennis or any contact sports, that tends to tell on the joints as you get older. All right. However, aging still does not have to be painful. What it requires is mindfulness and maybe a little bit of proactivity, shall we say? Thinking ahead and then working with what we have. And even if what we have is pain right now, well, okay, all right. There are things that can be done. There's always a solution. There's never oh, well, I'm older. It's just par for the course. No. So I'm not going to indulge age and pain are hand in hand. All right. So we're going to talk about some 7 tips to deal with common aches and pains in aging. All right. Deal? I We will talk about the pains, and we will talk about how we can manage it. All right. So, first, where do the pains tend to happen? Well, yes, in joints, because the cushion between joints, which is cartilage, that diminishes as you get older. So, instead of bone being nice and cushioned by cartilage and you can bounce and roll around and nothing happens, you fall and you bounce. And as you get older, the bones, they do tend to get less density. Cartilage is less thick. Muscle fibers tend to be less in their bundles. A condition known as sarcopenia, as it's all round, and it does put you at risk of falls and frailty and falls. But is that inevitable though? We're saying it can happen, but the degree to which that happens and the degree of pain which can come can be mitigated. So the reality is yes, that's gonna happen. All right. So where are the joints that are most commonly affected? The joints that have to do the most movement as you've been growing up. The neck, turning and twisting and bending and reaching and all that. That's neck joints. Shoulder joints. Yes, they've had their picking up children. You've had those of you with children picking up children, lifting things, just doing housework, literally, just moving around and even getting a dish from the upper cupboard will utilize. And if you've been active, playing sports, shoulder joints. Some sports such as tennis and uh, even swimming, although it helps, it still does have wear and tear. Knees, well, let's go in order. Lower back, why does that happen with older persons? Because, as you get older, you do seem to get shorter, right? Well, you kind of do get shorter because the bone density is less, the space is less. So eventually, everybody, instead of being like this, tend to go down, tend to be reduced. So it's the older person you may have known when you're growing up seems shorter, and they are. But that doesn't necessarily mean that everything is just going to pots and going to waste. No, it's the process. So we're managing that. We'll get to that. The next hips, of course, you bend, you stretch, you stoop, you stand, you drive, you walk, you run, you play sports. Again, wear and tear on those joints. Knees, especially, well, don't even get me started on knees and ankles, but knees most mainly because they tend to be, they're the bridging between top and bottom. They tend to take a lot of the force of walking, especially ladies and especially in improper cushioned shoes. I'm not talking of the orthopedic shoes. We're talking just heels that are way high, wearing them an entire day, shoes that don't have any support, back or front or side, shoes that do not fit your feet. As you get older, that is going to be able to squeeze on your joints, it's going to compress, it's going to cause corns and calluses and deviation of bone and muscle, and it just is painful. All right, that's the reality. That is the reality. So, what what can you do? What can we do? 7 tips we said for dealing. First of all, don't stop moving. Because the first thing that the body wants to do when you have a pain is freeze. If it's your neck, you're gonna just like and hold it and put it and try to make it comfortable and not move. There are times and places for that. If it's a shoulder, you're just gonna prop it and not move. There's a time and place for that. However, seeking doctor's advice, seeking therapist advice, and moving, just even if it's a gentle move. For those of you who can get to the ocean, like I can, don't often do in the Caribbean, sea baths, any aquatic therapy is really good because it's weightlessness, does not put pressure on the joints, but please do not stop moving because bones need that message. They need you to move so that they can keep building up instead of just breaking down. Muscles need toning so that their fibers can stop shrinking instead of at least maintaining a certain level of bulk that you can feel stable when you walk and reduces your risk of falls and reduces your risk of frailty. And you just feel better when your muscles and bones are strong. You just walk better. You walk strong, you walk upright. Don't sacrifice easing the pain for movement. If it hurts to move, tell the doctor, tell the physio, and they will take you through the paces, so to speak. In 70s or your 80s or even 90s. I've got patients who are in their mid 90s, late 90s, still move around. They still chipping. They're still walking. They're bending in their garden, and so it's not impossible. Don't stop moving. Just saying. What else does moving and movement allow? Well, I mean, moving around and getting regular exercise improves your mood. If it improves your mood, you're going to feel better mentally, right? You will sleep better because sleep does get disrupted with age. Maybe we'll talk a little bit more about sleep and aging another time, but you will sleep better. The mood exercise is said to be the mood stabilizer or the feel good because it releases all those feel good hormones. So moving is great for your mood. Moving is good for your heart. Your heart needs to keep moving. It's not just going to pump and pump and pump without, it would like a little help sometimes, you know. So move around. It's good for your heart, and we need our heart, obviously, to live. It also reduces, well, or lessens the severity of chronic illnesses such as diabetes, and it can tell you those persons who have maintained at least some relative activity in their lives have fewer of the severity of non-communicable diseases, hypertension, diabetes, high cholesterol, and therefore risk of stroke and heart disease. And some studies would suggest risk of cancer. And some studies show confirm less bone frailty and bones are less brittle. So again, fall risk is less. A stress fall because that happens so often in older persons because of not maintaining these things and because of the frailty. Okay. Overall well being, overall mood, overall just feeling good and strong. So it reduces bone waste, it reduces the rapidity with which muscles will break down. So how much is too much? Check with your doctor, but generally speaking, from the American Heart Association, 100 to 150 minutes of exercise, moderate aerobic, walking as part of your exercise routine daily. This is daily, yes. Um, is what's recommended for your heart health. Now, for older persons, you want to build or maintain your muscles. So safely check with your doctor and therapist if you do have one. What weight is safe? How much should I do? How much can I do? Can I just use my body weight to use the pressure with supervision? There's so many possibilities out there. Stay young, stay strong, stay stay young. There you go. Even if you do already have arthritic changes, you've had a knee replacement, you've had a frozen shoulder, and it's not, moving as it should, still, please move around. Move, move, move. I hope I said that enough. Move. What else can you do? Drink more water. Well, who would have thought? So the second thing, drink more water. Like, why? Because every procedure, every process in our body, from me talking to cellular activity to muscle activity to bone health, kidneys, heart, you name it. It is part of healthy lifestyle. Hydration is often neglected as you get older because you may not feel thirsty. But remember, muscles are full of fluid. Bones are full of marrow, it's full of fluid. We need to keep hydrated. How much water, how often you should drink it, average 60 to 80 ounces a day is recommended unless you have cardiac or other issues. Your cells need the fluids. The less fluids you get, the fewer fluids you give your body, the less it can move around. I mean, imagine a door without like lubrication. It's gonna creep, it's gonna be stiff, it's gonna stop moving. Same goes with joints. Hydrate, hydrate. It's good for your brain, it's great for your joints. Supplements. Now, if I had a dollar for everyone who's like, what can I take? What can I take? What can I take? There are a myriad of supplements out there, and I'm not touting one against the other, but there are generally, let's say, collagen, glucosamine, chondroitin, and well, that's mixed with MSM. Those nutrients are the nutrients that are intrinsic to the cartilage, the gristle behind between the bones, which as you wear and tear, they have reduced the wear and tear, or at least help you to move better. Some people swear by cod liver oil, shark oil, whale oil, any oil supplements, they have been known to help. Trust me, in the Caribbean, if you're Caribbean, please comment. Have you ever had the shark oil experience, the cod liver oil experience, the whale oil experience? Oh my word. You won't forget it unless you've had it. But I think it's done as well. And so, depending on what your doctor says and what you can do, supplements which contain oils and that are suitable for cartilage and suitable for bone, those are fantastic. Anti-inflammatory supplements, natural as well. Turmeric, those are anti-inflammatory. Garlic is anti-inflammatory. Curcumin, magnesium, zinc to a certain extent, they all come together to ease. So if it's in a shake, if it's in your food, if it's in your supplement, check with your doctor, but they do make a difference. And it really do. And there's research behind it, especially for knees for some reason. Shoulders too. Some might not be right for you, but again, just chat with your doctor. But supplements, I use supplements. Suggest the patients use supplements. Everything traditional won't work for some people. Now, if it's more pain than you can manage, there are you then you may have to take something for pain. Let's be real. You don't want to walk around in pain. There's much exercise and water and movement and aquatherapy and supplements you use. The pain may come, and it usually comes at night when it's cooler and colder and you're moving less. It will hurt. Okay, it is gonna hurt. So there is another range of medications from simple to anti-inflammatories to higher doses of medication. What you really want to do is have a trained person assess that discomfort and either apply heat or you take the medication temporarily while that pain is ongoing. If you do need ongoing pain medication, please have it supervised, please, because it can have untold damage to your stomach, uh, to your liver, to your kidneys, all of which are also aging and need a little help, need a little attention. Well, where are we now? I think we're at 5. We want to eat our vitamins. We just want to take them. So what are you going to do? Foods high in minerals, foods high in fatty acids. If you can, dairy, fish, leafy products, mineral, big mineral containing products such as kale, all the greens, all the what we call ground provisions. So sweet potato, fruits, vegetables, they're all building blocks of muscles and bones. If you can't tolerate them all in one meal, make them into a shake. There is always a way. You can put it in soup. There's always a way. Superfoods called antioxidants. Yes, we have those in our just in our everyday life. We mentioned turmeric already, magnesium. They're all in lots of fruit, vegetables especially. Now, if we understand the process of aging and aging joints, it makes it easier. So, the ache and pain is it a normal part of aging? Eh, it's part of the process. But does it have to be painful? No. So, we're going to go with the 7th, and this is basically a caveat or yeah, note to self and sort of a I wouldn't say warning, but just being aware of if the pain is causing numbness or tingling or weakness to your limb or to the area, that's a sign. That's a serious sign you need to seek your doctor's attention urgently. If you've had a recent fall and you're not sure that it hurt somewhere, just check it out. Older bones don't behave like younger bones. They don't. If you have unexplained weight loss and you're even if you're exercising but you say this weight loss is more than it should be, something's wrong. If you have back pain and it's affecting your bladder or bowel function, that might indicate nerve damage. Seek doctor's advice like immediately. And if you have changed any medication, or if your lifestyle has had to change, or if you've had to suddenly go into caregiving and your entire world feels upside down, so you're not even sure how you're going to get the exercise done to maintain your health, that's another indication to seek the help of someone who can give you some answers. Pain that does not go away despite medication, despite home remedies, despite therapy, may need imaging as x-rays or MRI or CT scans. And so you do want to be aware that there are tingle tinkle red flags about that. However, we've come to, yes, acknowledging painful joints come with aging. Aging does not have to be painful though. So do your fluids, do your supplements, eat your vitamins, yes, and move. From my heart to yours, Dr. Lally, just encouraging you to keep moving, stay healthy, keep your mood up. It is a process, it's not a disease. Age like fine wine. Have a wonderful morning, evening, or night from my heart to yours. Saying, just enjoy life. Mwah. Painlessly.